Okay, so this is a superficial release of the general posterior fascia. What we're going to do is begin to hook up and underneath the traps, and we're gliding down the paraspinal group. This hand can either be supporting yourself, or it can be even doing a light traction. So we're gliding down the paraspinal group, and I'm using really the first 2/3 of my elbow, from here down. And I'm just gliding down the paraspinal group, laterally to the spinous processes. And you're going to see a small wedging effect happen here. So what I'm trying to do is take the paraspinal group and that fascia towards the midline. So I'm gliding down. That speed's about right. Once again, you want to sink in slowly into the tissue, stay at that level, and then glide with your elbow or your palm or your fingertips, depending on what tool you're using. And move up with the body as well. And once we get down to nearing the sacrum, then you're just going to exit. You're going to repeat this 2 or 3 times, and each time you're going to move slightly medially. So I started off here, gliding down. So next time I'm just going to move a little bit closer to the spine, but once again not on the spinous processes. So just moving slightly closer. Our goal is just to move the paraspinal group over towards the midline. And make sure you're breathing. Keep your hands relaxed, keep your wrists relaxed. Check in with the client. How's the client doing? On a scale of 1 to 10, 10 being very painful, you should be around a 7. So keep in communication. Moving slowly. The slower you go, the deeper you can get into the tissue. When I first start a technique, I go into the most superficial of the tissue. And then as the tissue begins to release, it allows me to go into a deeper level or a deeper layer. So an advanced technique for this particular release is to have movement. So what I'm going to have Anthony do is he's going to do an anterior and posterior pelvic tilt. So he's going to and then just do the opposite movement now, Anthony, for me. Good. And he's going to do that movement really slow. As I'm gliding down the tissue, Anthony's going to continue with that motion very soft, very slowly. What does it do? Well, it actually engages the fascia. It gets movement happening, and when that movement happens, it actually tightens up the fascia, which allows you to get a little bit deeper release. Another movement I can have Anthony do is I can have Anthony actually gently reach with his arm, almost like he's trying to touch something over his head. He's going to be reaching with his fingertips as I'm gliding down the body. And where do you start with your elbow? Theoretically, it doesn't matter. And he's going to straighten your elbow, Anthony, and continue to glide down. Make sure your body's going in the direction of the actual stroke. So watch your own body mechanics. And always check.